Chronic diseases are the main killer in Europe. They are the main cause of disability, and they are the largest burden on any of the health service.
We have an increase in chronic diseases, mostly because people are living longer, but also because we are not changing enough our lifestyles. Take diabetes, for instance. It's on the increase because we are not doing enough physical exercise, we have bad nutrition, and tobacco consumption and alcohol consumption is still very high. Through this summit, our intention as a Commission was to put it back on the political agenda by inviting member states and also stakeholders.
56.3 million people, or 8.5% of the European population, live with diabetes. We are here at the EU Summit on Chronic Diseases to raise awareness on that disease.
Empowering patients to know more about their disease improves health outcomes, and this technology that you see here, it's basically a way for someone that doesn't have a chronic disease to really empathize with what it is to have a chronic disease.
With the increase in the aging population of Europe, the increase in chronic diseases, the reduction of the money available from budgets to apply to healthcare, we have a serious problem in the future, and we need to address the question as to whether the acute demand system of the delivery of healthcare in hospitals, is this the right model, or do we need to shift and change that to a more preventive model with care in the community?
In Italia abbiamo calcolato che soltanto con i corretti stili di vita possiamo risparmiare 3 miliardi di euro l'anno in spesa farmaceutica e far stare bene le persone senza prendere farmaci. Questo è un modo di affrontare la malattia. Dall'altra parte poi vale per tutte le malattie croniche, noi dobbiamo cercare di gestire bene i malati cronici. Una volta che sono usciti dall'ospedale devono poter continuare le loro cure a casa, essere seguiti dalla medicina territoriale e in questo modo vivere meglio la loro malattia con un impatto sociale migliore per tutti.
If you look at the national health budgets, only 3% goes to prevention, while 97% go to cure. This is, it doesn't make sense. And in times of crisis, of financial crisis, where everyone is cutting expenditure, we need to invest more in prevention in order to save money more. But basically, prevention means we save people's lives, and that is the most important thing.
We are also working to spread the best practices in early screening of chronic diseases. We are working on specific chronic diseases like diabetes. And in fact, what we do is that we work with the member state and with the national authorities to identify best practices and to spread these best practices at national and local level.
The challenge of chronic disease management is not the highest tech, which is what the media would often let you believe. The challenge is how to get the cheapest things that work for everyone available to everyone. This meeting hopefully will lead to some understanding on actions that health systems can take together.
With an aging population and the increase which we have in the figures of chronic diseases, it's very difficult to see how we can match the needs of the population for healthcare and the money which will be available in the future. And therefore I think this is really a contribution which we can make, increasing the standard of people's public health, in other words avoiding diseases where we can, and at the same time contributing to a reduction in the costs of our health systems and making them more sustainable.
The elections are soon, we will have new parliament, new commission, and I think it's crucial for all of us that we make sure that the new politicians, the newcomers, will have chronic diseases and healthcare in their focus for their all mandate and years to come. Otherwise, we will end up in continuous conversations that we have now for years, like the economic crisis, the financial ministers not talking with the health ministers. I definitely think healthcare is such an important issue that it should be a priority for everyone.